Hi, everyone. Debbie Fazio here. Thank you so much for joining in on our podcast or YouTube. I'm so excited to share with you my guest today, Brianna Maddock. Thank you so much for joining today, Brianna. How are you doing?
Hi, Debbie. Thanks so much for having me. I'm doing great. Thank you. It's nice to be here.
Good. I'm so glad. Well, you are a PNSW, which stands for Perinatal Support Worker. Can you share a little bit about what that is exactly?
Yeah, absolutely. So I am a registered perinatal support worker. So that means that I am a trained professional through the college at Mohawk, and I support people through fertility, pregnancy, labor, delivery, and birth, and then also for postpartum up to 12 months.
That's wonderful. Well, thank you so much. You're doing some great work in the community. So that's great. So good to have you. So today we're talking about the purple cry.
Yes, I actually really love talking about the purple cry, so I'm very excited.
Good. I'm glad. Now, let's be clear. When we're talking about the purple cry, it doesn't mean your baby's actually going purple. Purple stands for an acronym. So excited to share a little bit about this because I think it just enlightens parents. So tell us exactly what is the purple cry?
So the period of purple cry is it's actually a normal developmental phase that infants go through. Typically starts around that 2-week mark and can last up to 3 to 4 months. And all babies will experience this phase to some extent. Actually, it was Dr. Ronald Barr, and he was a developmental pediatrician who's done a lot of studies on this type of developmental phase. And he's probably done more studies on infant crying than anyone in the world. And he's come up with this phase of the period of purple cry. So that is, it's typically, when your baby is unconsolable and crying, and it's very specific to the development. And it's that 2 weeks to up to 4 months.
Okay. Now I know that a lot of families out there who have a baby that cries a lot, they probably diagnose it, whether at home or via a doctor, as colic, the famous colic, colicky baby. So can you tell us a little bit about the difference?
Yeah, so like colic is a term that was used for like excessive crying, really puts a lot of focus on there's something wrong with your baby, you have to do something, you have to fix it. Whereas this is more of your infant is going through something very normal that, they are, it's kind of a challenge for them to go through this, right? So this is very specific, and that's where the purple comes into play. So that purple is the acronym for what is happening. So they have a peak of crying. It's very unexpected. So there's nothing that has triggered this response. So, if your baby's comfortable, they're clean, everything is good, they're not hungry, that they resist soothing. So it doesn't matter what you do, you can be doing all of the things, pacing the floors, all of the rocking, and it's just, they're inconsolable. They look like they're in pain. So they have this pained look on their face. It's long lasting. And it could be, hours in a day that this is happening, that you're experiencing this. And a lot of times it gets worse in the evening. So that late day into the night is when they're going to experience more of this crying.
Right. That's great to know that, because I think a lot of parents will hear a baby screaming and think, oh my gosh, something's wrong.
Yeah.
And I need to do something. And we continue to do thing after thing after thing until the point that we kind of get upset or anxious or, go beyond that point of no return. So is there any suggestions or tips if someone is thinking that their baby is going through the purple cry, any suggestions that you might have for that parent?
So I would say that parents that are going through this and their infants that are experiencing this purple cry period, the best things that they can do is to be mindful of what they're experiencing, acknowledge that this is a phase, this is something they're going through, and just being aware of what's happening can be really, really helpful for parents. That's why having the conversation about this is so important. Ask your support system for help. Take a little break. If your baby's crying and you're feeling that you're super overwhelmed and you're like, oh my gosh, like I just can't do this, I need a minute. It's okay to put your baby down in a safe place in their crib, let's say. And if you need to step away for a few minutes just to, regain your composure, that's okay. And you're doing best by your child by doing that, because you're removing yourself from a situation that you feel like maybe you are not able to handle right now. There's also this wonderful, I most call it a tool, and it's the Happiest Baby. And they talk a lot about the 5 S's. And those 5 S's can be super helpful for calming and soothing a child that's inconsolable. So just those little things that we can do to help, right? So take that break and reach out to support systems. So, call a family member, call a friend, say, listen, I just need some support right now. I need you to be here. I need to go and have a shower, take care of something for yourself. And then also times that's where a PNSW like myself can come in and be, very supportive and give mom and dad a break and, let them have that time and they know that their child is taken care of by a professional. So those are, all great things that I would recommend to people who are experiencing this.
That's great. Well, you addressed some important things, but this is something that can be common. Doesn't necessarily mean something is wrong and that you have to fix it. But sometimes awareness is key. So just sharing with, the Purple Cry with parents and letting know that this is something that might happen with your little one, just to understand why it's happening. Keep calm as you can. If you're sort of hitting that point of no return where you're feeling anxious or upset and feel like you might do something that's dangerous, then put your baby down in a safe place, go take some time to recompose and get some help. So you've given a lot of information here. That's wonderful. I think the key too is just sometimes letting parents know what's going on with their baby, and that it doesn't necessarily need a diagnosis or medication. Sometimes that is the biggest piece of help that you can give parents. And that's why we love doing these podcasts with professionals like yourself, is just to give parents as much information as we can. Is there anything else you want to add to the topic of the day?
I don't think that there's anything else that I necessarily want to add, but I do agree that awareness is such an important piece when it comes to this. And the more information that parents have, the better off our outcomes are going to be, right? So having the conversations and doing this and spreading awareness, especially about things like Purple Cry, is something that's so important, and it's something that I'm so passionate about. So I really appreciate being able to talk about this today.
That's great. And I guess we'll leave off, if I don't want to put you on the spot, but do you happen to have a website that they can actually go and look up more information for the Purple Cry? I know that they've done extensive research and have lots of different resources as well.
Yeah, absolutely. So there is a website. I believe it's purplecry.org. But a simple Google search for Purple Cry or period of Purple Cry will take you to that website. There's a lot of great information. There's wonderful resources, informations for not just parents, but also people supporting parents during this time. It takes a village. So the more knowledge that everybody has, the better we're all going to do. And then those 5 S's too. For more information on that, a Google search of the Happiest Baby is a great resource as well. There's a lot of great information on how to things that you can do to help during this time.
Amazing. Thank you so much, Brianna, for joining today. Always a pleasure chatting with you and learning from you. So thanks everyone for joining in, and we'll see you next time.
Thanks.